Hello, my name is Tarita Basanta, and my topic is HIV in America and the growing rate of HIV infections in patients in the United States. Since the discovery of the disease over 3 decades ago, the transmission rate in the United States has continued to increase. There's also a stigma attached with the disease in that it is a gay man's disease, that is, men having sex with men. This is absolutely not true, and the population of heterosexual contact has increased in the United States. Some of the programs that have been successful in the United States are those that include testing, treatment, and education. However, the gaps in care with these kind of programs are that they are not able to find highly qualified clinicians to treat these patients, and the cost of the ART medications are quite costly. In reviewing some of the scholarly articles that I read, one that comes to mind is one from the New England Journal of Medicine that chronicles the PrEP program, which is the pre exposure program. People that display risky sexual behaviors and that are HIV negative are put on a therapeutic level of ART medication, antiretroviral medications, and they're required to take them daily and be monitored monthly. These medications have become highly effective in reducing the amount of transmission among these patients that are highly susceptible to the disease. Another article that I read by Haley chronicles the World Health Organization and their recommendations for moms that breastfeed. As we know, they recommend that moms breastfeed up to the age of 1 year old for their infants. These infants can get the disease transmitted to them via breast milk because it has been found that the breast milk does contain the disease. So the World Health Organization has put out guidelines that these moms should not breastfeed but bottle feed instead to prevent the transmission. There's another article that I want to discuss that is from the American Journal of Pediatrics that looked at prenatal patients that were HIV positive. Those patients that were HIV positive during their prenatal period were put on ART medications, and they remained on them throughout the pregnancy, and their babies are delivered via C-section because it was discovered that going through the birthing process through the birth canal does expose that baby to the HIV virus. So therefore, being on that medication and also delivering those babies via C-section prevents the mode of transmission from mom to baby. Now, in developing my program, there are some factors that I would include: the education piece on how to have safe sexual encounters, teaching barrier methods such as female-male condoms, PrEP program, and abstinence. Also, eliminating the stigma associated with the disease and that it is a gay man's disease. Free medications, there are programs out such as the ADAP program that is federally funded that gives those patients free medication, which has been a barrier to care because they couldn't afford the medications. And monitoring those patients for opportunistic infections, and if they are contracting those infections, being treated promptly to give them better outcomes. My reason for choosing this topic is because there's a wealth of information. There's over 3 decades of organizations working solely to prevent transmission. There have been research studies to help along with the decrease in transmissions, and there's just all kind of community resources out there through the Ryan White Foundation and other foundations federally funded through the government. Some of the vulnerable populations that I discovered that are problematic are those that work in the sex trade uh, organizations, male and female, that display risky behaviors while having sex. Those people receiving blood transfusions, even though it's not common in the United States anymore, it still does happen because of a hospital era. Also, surprisingly, those people over the age of 50 that are in heterosexual relationships that are not displaying monogamous relationships are also vulnerable. Some of the problems that I've learned that are associated with effective treatment are affordable medications. As I stated earlier, the medications are very expensive, and being affordable or free keeps the patient compliant. Um, having more community resources in lower socioeconomic areas, more community clinics, more community outreach. Education to erase the stigma around the disease so people are more likely to go get treatment and stay in treatment while they're treating the disease. Counseling for those people, teaching them how to use prophylactics, giving out male and female condoms at the clinics for free also cuts down on the transmission of the disease. And also doing more community outreach in those areas where the HIV rates are higher, doing health fairs, going door to door with health teams that include nurses, social workers and outreach workers to help educate them and give them more sources and point them in the right direction to get into treatment and care. And lastly, providing counseling for those people because, as we know, a lot of people fall into depression because of the disease. But we know now that people are living longer, people are having healthier outcomes, and living longer because of the medications. Thank you for your time, and this is Tarita Basanta again. Thank you.